To discuss the health consequences and lethality of loneliness, Dr. William Shrank, Chief Medical Officer, Humana, and Donato Tramuto, founder and chairman of Health eVillages and of the Tramuto Foundation. They join moderator Katie Couric, award-winning journalist, founder Katie Couric Media, and co-founder Stand Up to Cancer.
Hi, everyone. I'm delighted to be with you today and especially excited to get into a conversation about something that I care deeply about. That's loneliness and social isolation. And I'm joined by Donato Tramuto and Dr. William Shrank, two people who I know are passionate about this topic. We don't have much time, so I want to get right into it. Donato, I want to start with you. How did you get interested in the topic of loneliness, and how would you even define the word?
Well, thank you, Katie, and it's a pleasure to be here with both you and Will. I think for me, loneliness started when I lost my hearing at age 8, and for about 10 years, I had little or no hearing, and I fell into a deep sense of social isolation. But I think that it really heightened for me when I became the CEO of Healthways, now Tivity Health. And I was running the Silver Sneakers program, and I had a chance to go out and visit about 10,000 seniors. I made a commitment as the CEO to go out and meet with these seniors. And what I realized, Silver Sneakers at the time was a program for physical fitness for seniors, that the seniors were not going to the gym to bench press 150 pounds. They were going there because it was their only outlet for social connections. And the light bulb went off in terms of my understanding this enormous health issue. And I think and I think Will would agree with me on this, I think for too many years, we've really addressed sick care and we haven't addressed health care. And I think social isolation, and there's been tons of definition. I know, Will, you probably would agree with me on this as well. I've seen 9 different definitions that describe loneliness. And I think the best way that I can describe it is probably the common 2, which is social isolation, but also loneliness. You can be in a group of 100 people and still feel alone. But there's 2 more that I think I would add as a result of the pandemic. One is the social loneliness, that many people are now struggling with social loneliness during this pandemic because they're unable to get out and connect.
Right.
And the last one, which comes out of the research that we've done for my second book, is the state of relevancy. That the greater the loss of your feeling of relevancy, it's correlated with your state of loneliness. And so I think we really have to address, how do we get relevancy back into one's life?
And Dr. Shrank, before we broach that topic, it's not just seniors, and it really predates the pandemic. How do you explain the prevalence of loneliness in our culture? Is it a willingness to talk about it? Did it always exist? Or are there different societal factors that are at work that are creating this situation for way too many people?
Oh, it's a really good question. And there's so many features or factors that impact one's sense of social connectedness. There's a ton of structural reasons that are driving this, what appears to be a much greater rate of loneliness around how families stay together and the sense of community, work-life balance. But if there's this sense that loneliness is spreading, it may be that that's exactly what's happening. There's this really interesting research out of Yale that shows that loneliness is contagious, that a person is 52% more likely to feel lonely if someone they're directly connected to says they're lonely. And it makes sense. It only stands to reason that lonely people are less able to pick up on some of the sort of the positive social stimuli and the commitment signals that they see from others, and they withdraw, and that makes others feel like they're going to withdraw. There's also a whole host of issues around technology and around the use of social media that I'd love to talk more about. That it does feel like there's a lot of things happening all at once to really increase the prevalence of the problem.
It's true. And FOMO, I think, is created by social media. And I think it's supposed to connect us. And yet I think it makes, what do they say? Comparison is the thief of joy. And it makes you feel like, well, what's wrong with me? Why am I not out enjoying my life the way these people are? Of course, it's highly manufactured and curated, but I think social media has had a big impact on it. Donato, would you agree?
I do, and it's very, very interesting. And I think, listen, I don't think none of us want to go back to 100 years ago where we didn't have the sense of technology. But I'm a firm believer, all of one thing can either, ruin the capacity to have connections or it can, interrupt it. And what I mean by that is that I do think that there is healthy social media platforms. We should really pay careful attention to what's going on in the UK. They were the first to appoint a minister of loneliness. But in a survey that they conducted, very interesting, 25% of the parents that they interviewed felt that the social media was actually helping their young children with loneliness. But when they did the survey of the children, greater than 50% felt that social media could help them to not be lonely. And so there's a divide among the
Right.
generation and the younger. Now, what I recommend is that we have to, as parents, promote healthy social media platforms. That perhaps we shouldn't be promoting Instagram where your friend's life looks better than yours and you fall into this state of loneliness. But perhaps we can promote something that our foundation did a year ago. We created a weekly Inspired Chat social media calls where we bring young, middle-aged, and older people together. And they share their thoughts about what the pandemic has meant to them. They share their thoughts about their family relationships. And we have documented it, it has helped to prevent suicide among the younger people. So there are ways that we can promote social media and technology as parents and as adults that create a good outcome and doesn't necessarily create a negative outcome.
So Donato, I love how you framed that, because I think in general, we think of the interactions that happen on social media as very superficial. We rarely think of them as ways to deepen existing relationships with family or friends or strengthen relationships. They're generally much, much higher level. And that leads to really a vicious cycle where those interactions are so easily accessible. They replace meaningful, deeper relationships with people that you would otherwise see in person. And creates that sense. And there's this really interesting research that shows that you got two people that are sitting next to each other and talking, just the presence of a phone nearby, even if they don't use it, makes that both people in the conversation rate the conversation as less meaningful.
Right. Because it's distracting. It's distracting, and even the presence, on a table makes you less focused on the person in front of you because you're wondering what you're missing on your phone. I wanted to ask you, Dr. Shrank, though, what about, I don't want to go back to the 1950s and 60s necessarily, but it seems like this sense of community we had with churches and synagogues and community activities. It feels like that just doesn't happen as much. Is that one of the reasons, Kiwanis clubs and things like that brought people together? And I'm curious, has that had a big impact on kind of not feeling connected to your community on this increase in loneliness?
Well, we're sure that trend is an important and problematic one. And frankly, that's a really central reason why we at Humana have a real deep focus on working in communities around solving these problems. You can't solve these problems, simply by making outbound telephone calls. The way in which we're really focused on supporting our members who are lonely is by creating a richer social fabric within the communities in which our members live. And that means partnering with churches and the places where our members congregate. And it means trying to take a much more holistic view of how our members interact with the communities around them. And I think, Katie, you're getting right at the sort of the heart of this, is that the primacy of those interactions and relationships and communities, are sort of the source of the solution.
Go ahead, Donato.
If I may add to that, Will, you're right on. I mean, look at communities that have colleges and universities there. These young kids that are going to college miss their grandparents, they miss their parents, and yet you have seniors that live around that university and college. That, for example, I am an honorary scholar at St. Joseph's College, and we created an opportunity where we bring seniors in, before the pandemic occurred, of course, where we bring seniors into the campus. And what happens is that you have this interaction with the college students who love to interact with older people. They're missing their and then you have the grandparents who miss their grandchildren because they're miles away. So Will is right on. Yogi Berra, my favorite philosopher, once said, "You can observe a lot. You can observe a lot by just watching." There are venues in the communities that we have to promote. You're right. The churches and all of the infrastructure has changed. But what hasn't changed is the fact that we can save ourselves, and we're going to have to work together to do it. And we're going to have to unite all the services that are in a community. They're there, but many seniors are not aware of it. We met a young gentleman who I know you've connected with, Katie, who started a social media educational company. He's 16 years old. He's training seniors how to turn iPhones on. He's training seniors how to use social media. Now, he's educated almost 1,000 seniors whose lives have changed. So there are venues that we can tap into in the community to, hopefully address this problem.
Talk to us about the impact on dementia, heart disease, all kinds of things, which makes this a public health crisis, not just kind of a woo-woo conversation like, we want to hold hands and sing Kumbaya. It has a huge impact on people.
Yeah, it's really important, I think, to put loneliness in the context of the broader impact it has on the healthcare system and on the health of all Americans. And it really is considerable, Katie. You're exactly right. The evidence shows really profound associations between social isolation and dementia, on the order of a 50% increased risk of dementia for those who are socially isolated. Higher rates, 29% higher rates of heart disease, 32% increased rate of stroke, higher rates of a whole host, not surprisingly, of mental health issues, including depression, anxiety, and sadly, suicide. This is a lot more than a subjective feeling. This is something that really dramatically and meaningfully impacts the health of those who experience it.
Donato, in closing, I guess one silver lining, and it's hard to call it a silver lining when the pandemic has caused so much suffering, but I think people are actually, in a way, it's turbocharged this conversation, and it's made mental health less stigmatized. It's made kind of our emotional well-being something that has kind of come out of the closet in a way. Yeah. How have you seen conversations? Because we've been having these, Donato, for a while, pre-pandemic. How have you seen them changed, and how is that a positive development as we try to tackle this issue?
I've seen a remarkable change. A year before the pandemic, I was speaking at a healthcare conference, and there were 1,000 individuals in the audience, and I was speaking about this topic. And I asked, how many in this audience have felt lonely? Only a few raised their hands. And it wasn't until I shared about my own loneliness. I said, I have a loving partner, a loving family. I have lots of friends, and I have felt lonely. And everybody raised their hands. Today, I've seen a tidal change where everyone is in this together. We are experiencing loneliness. And so there's more of a willingness to have the discussion. And I think we have to be willing to promote that discussion and let the other person feel comfortable in sharing their state of loneliness.
Hey, if I could just quickly just pile on, we've got to ask. We've got to ask. We've got to ask people if they're lonely. This has to be part of in the same way that we screen and ask our patients and family members and friends about how they're feeling. This is part of the process. It has to be a destigmatized part of the way we just talk about our general well-being. It's part of the conversation. We've got to ask.
And if I may just add to that, Will, I start every conversation, as Katie knows, by asking people now about their lives. And we have failed to we've had versations with people. We haven't had conversations with people.
Donato Tramuto, Dr. William Shrank, hopefully this conversation is a start and people will begin to have these really important conversations. Thank you both so much.
Thanks for doing this.
Thank you, Katie. Thank you, Will.
Appreciate it.